That is the reason that we have our level of care assessments, is we meet together to decide what level of care is appropriate. Most of the time we get our kids coming out of the hospital, coming down to us, meaning they're going to a lower level of care, coming to our PHP or our IOP program. Or you're meeting with your therapist or your psychiatrist and they're recommending maybe something a little more than weekly visits, then that lets us know that IOP is most likely appropriate for your kiddo. When they come in for IOP, we have a short time for them to get acclimated to the space. They can have a snack, they can talk with their friends as they're getting used to the space. And then after about 10 minutes, we go back for group. We follow that same pattern throughout the whole 3 hours. So they'll do about 55 minute group, and they'll have about a 10-minute break, and then back to group, break, and back to group. And that gives them time to eat snacks, to use the restroom, to talk with staff in between the groups. They're not just going 3 hours straight sitting around a table. That gives them time to get up and move around and to take care of what needs to be taken care of. If we ever have any safety issues, all the staff is trained in de-escalation techniques and how to best handle each situation. With the kids, we a lot of times notice before it can happen, and so we work really hard to get to know them and to understand their triggers so that we can be ready so that we don't have safety issues. If anything does happen, the family's involved. We make sure that the whole group is safe and that the child is safe, and we make sure that we have enough staff present to take care of whatever needs to be taken care of. And we involve everybody in safety issues. We will bring the family in and talk about what happened and plan out to make sure stuff like that doesn't happen again. Or if it does, we can handle it better. We have 4 full-time therapists. Each one of them is a licensed therapist. And so they run the groups and they take turns. They each have different styles and kind of different backgrounds. Some are really good in the group setting with DBT skills. Some are more cognitive-based using CBT skills. Some do better in the expressive arts with art. We have some who specialize in mindfulness, doing yoga, sound bowls, more somatic modalities. And so the group members get a little taste of different types of therapies depending on the therapist. We try to match up for individual and family sessions, which would work best for each client and each family. We try to match up the therapist that would work best for that family or that client. We require that families are involved in treatment here. When you come to Embark, it is a whole family that we work with and not just the individual. Yes, we have the client that is here the majority of the time. While they are setting goals, we also ask the family to set a goal and participate in weekly family sessions. And we can be flexible in that. We know people are busy and there's work and distance and traveling, so we can work through hybrid, we can work virtual, phone calls, but we make sure that the family's involved and that they set a goal and that they achieve that goal by the time they're ready to graduate. We make sure that we take surveys and outcomes with our clients about every 2 weeks, and we measure anxiety, depression, distress tolerance, family functioning, therapeutic alliance, overall general wellness. And we track that over time, and that lets us know, are things getting better? Are things staying the same? Or are things getting worse? And so that lets us have those open conversations, especially in family therapy, about is this program effective for your child? And if we need to make changes, if we notice that there's a plateau or things are getting worse, then we need to talk about why that is and so that we can address it. So once we graduate IOP, we go back to normal outpatient therapy, which is once a week or bi-weekly, back with a therapist that you either had before, or if you're looking for someone new, we help with case management to help find a good fit for you. So we help also set up medication appointments, anything else that you may need once you graduate the program. We do warm handoff, meaning we share what we've been working on this whole time so that we don't lose any of the momentum that we made while we were here. And so we work with your clinicians after here and we make sure everything's set up. And if there ever is issues when you do graduate, you are more than welcome to reach back out and we're happy to help. We work closely with the schools. If your child is on independent study or has been removed from school or withdrawn or expelled, we work with you and whatever's in best interest of the family and the child in regards to their school. So we can talk with schools, we can fill out paperwork needed for schools, they can do schoolwork here, and we can be flexible with our schedule to make sure that we can make school work and figure out what's the next best step to get your child treatment, but also take care of school that needs to be done. That is something that we are very aware of. We have rules in group, certain things that protect the kids, things that we talk about. And the kids, when they're here, they're always around staff. They're never alone. They're not with each other alone. So any war stories or anything like that that comes up is addressed. It does happen. Things get talked about. We don't shy away from it. We just talk about it in the moment and process. Why did that come up? How may that trigger other people? And how is that maybe not helpful? So we address it in the moment and try to take care of that. And we're just aware of it. We see a lot of up and down, especially when we're taking our outcomes of things getting better or things getting worse, depending on treatment. I'd say a typical timeline is when we first get here, things look like they're getting better. And then as we start to get into some real issues in individual sessions and family sessions, things feel like they're getting worse or feeling worse because we're starting to really address some deep issues. And then we'll see a gradual rise as they get close to graduation of feeling better and scoring better on their surveys. So it's very typical of things being okay, feel a little bit better because we're getting treatment. As we get into the real issues, things feel worse. And then as we deal with those issues and come up with plans and process those, things tend to get better. So it is kind of look more like a roller coaster than a straight line of things getting better. And that's a pretty typical for most people who join group. In PHP, Partial Hospitalization program, that program is specific for stabilization and safety. You are here in the clinic 5 hours a day, 5 days a week. That is the next step after coming out of the hospital or a residential treatment center. It is a shorter program than the IOP, 6 to 8 weeks, and with the key focus being that safety and stabilization. A lot of times we're starting new medications, we're dealing with family issues and trying to provide safety back in the home environment. And so having a 5-day-a-week program for 5 hours provides that safety and stabilization. It's not needed long-term, and that's why it's only 6 to 8 weeks. IOP is 3 hours, 3 to 4 times a week. And that group is meant for after school, in the evening, so that you can live your life, go to school, and then still get your treatment in the evening, and continue those goals that you had set in PHP and continue working towards them. IOP is a little bit longer since it's less days and less hours. It tends to work better to be about 3 months, 12 to 14 weeks. We see the most success with our students or with our clients. A typical day for PHP, for the 5 hours of therapy that they have, we come, we check in, we do a DBT check-in. That's checking our anxiety, our depression. How much did we sleep? How much did we eat? What are our urges? Are we feeling any urges to self-harm or to use substances? or to run away or to shut down. And we use that as a baseline check-in. And then we start our groups. So between the 4 hours of group, we separate one of those hours as executive functioning, where we can do schoolwork. We dedicate that time to help with the independent studies, with getting schoolwork done, if that's what we're still doing. If we don't have schoolwork, we help the kids work on any sort of projects that they're interested in. We can do like research projects, something outside of therapy to give their mind a little break. We do something, and that's what we call executive functioning, to work on the executive functioning part of the brain and to get more of that logical or critical thinking versus the previous hours of them focusing on emotions and feelings in the therapy. So that's the main difference. And then with it being 5 days a week, the hope is to really ingrain the skills. If they're talking about it for 5 hours a day, 5 times a week, it can really set those skills to be utilized because they're talking about it and using it every day. When they graduate, after we do our 6 to 8 weeks of PHP, that means that we have reached our goals of being stabilized, we're safe, things are looking and feeling better, but we still need the support. When we go back into our home environment, we start to get more freedoms. We go back to school, we go back to work, we have more time alone. So it is important that we don't just go straight back to outpatient therapy once a week. So that's why we recommend after PHP, you go into IOP so that you can get back into that home environment, but have the support of your therapy team, of your group. And so, yeah, the goal is once PHP is completed, we move to IOP for about 12 weeks. And that should and then the goal is move on to outpatient after the IOP, just to keep providing that support in the home environment. We provide medication management in the program. We have a nurse practitioner under our medical director who meets with all of our clients and their families. They work on managing current medications, starting new medications, removing old medications. And our nurse practitioner works closely with us. We meet with her weekly, where she talks about what she's seeing in her meetings, what we're seeing in our therapy, so that we can work closely together to make sure that everything's aligning. We take into account history, what you've tried before, and really want to be sensitive to what's working, what's not working, and getting the feedback from the family about how medications and providing a safe place to talk about it. If you already have your own medication provider, we're happy to work together in tandem with them. We like to work together with previous providers and then also providers that we may be discharging to so that there's no lapse in care. We work really hard to have a good continuum of care with our clients, that we work with their med provider before, during, and after to make sure there's a smooth transition. If you're unsure about what you're looking for or what level of care is appropriate or if group is even for you, we do offer tours. Feel free to give a call to the clinic. Come and do a tour. We even do a trial day, whether you're an adolescent or a young adult. Come sit in for a day on the group and see if it's something that you can be a part of and something that can be beneficial to you. That is open to anyone that wants to try that out.